More than half of people worldwide are missing one or more chewing teeth. Often in such cases, a person chews on the other side where they still have teeth, thinking that restoring them is time-consuming and expensive, so they put it off, planning to do it later somehow. Like this video if you've ever experienced this. The absence of chewing teeth is especially insidious because they are not in the front, so people around you don't see that the tooth is missing, which is why many postpone dealing with this issue for a long time. Accordingly, if there is no tooth, there is no pain, but there is a fear of pain when getting an implant, even though the problem can be solved without one. What's actually scarier is that if you're missing one or more chewing teeth, the remaining healthy teeth have to take on more load, causing them to wear out and erode faster. Your bite changes, your jaw visibly ages, the temporomandibular joint becomes overloaded, starts clicking, and pain develops in it. In the area where the tooth is missing, the bone recedes, and because of this, future treatment can become more complicated and, most importantly, more expensive. I'll explain what to do in such cases and how to restore a tooth inexpensively and without an implant. So make sure to watch this video until the end. If you don't have your molars, it's not just about food and poorly chewed meals. Most importantly, it's about disrupting the entire dental and jaw system. In other words, even the absence of just one molar can actually start to change your bite. What happens if you don't restore your molars in time? The first thing is the shifting of neighboring teeth. That is, the teeth start to shift either toward each other or move toward the so-called antagonist teeth, which are located above or below. In other words, when a tooth doesn't feel support, it begins to, so to speak, grow upward, it moves out of place, and the teeth change. Such shifting leads to the situation where, if you later want to place a crown or implant in the spot of the missing tooth, you'll have to have the neighboring teeth treated by an orthodontist using braces. In other words, you'll need to move the shifted teeth back, so to speak, to free up space in order to place the implant or crown.
And over approximately what period of time can the teeth shift like that?
Of course, it is highly individual for every single person. But if you do not take the time to restore that missing tooth within a period of 2 to 3 years, your remaining teeth will already begin to shift significantly. Although there are certainly some cases where, in fact, this movement can happen in as little as just 1 year.
So within a year, there could already be such changes that you'd have to get braces or somehow move the teeth back into place, right?
You might not need to get braces right away, but there will already be changes. So, for example, it will be a bit more difficult for the prosthodontist or the surgeon to develop a rehabilitation plan. It might not come to braces.
So, do they just put it in that spot and then the teeth will move apart again?
No, they won't move apart. Most often, all of this will be compensated for by the size or shape of the future crown or the future teeth themselves. They might be made a little bigger or, on the contrary, a bit smaller, specifically so that you don't have to involve orthodontic treatment. The next consequence is the overload of the remaining teeth. It's very important for patients to understand this. We always talk about it and explain that patients always chew with the teeth they have. Very often patients mistakenly say, "No, I chew with my gums. I don't have teeth, I only bite with my front teeth, and I chew with my gums." In reality, that's not possible. In other words, we chew with the teeth we have. As a result, most often these teeth are not even meant for chewing because they're the front teeth or there are simply too few of them. And of course, all the load falls on the teeth that remain. And this overload primarily leads, of course, to our gums receding because there's excessive pressure on the teeth. The tooth also starts to thin out, wear appears on such teeth, and of course, we end up losing them. In fact, this happens quite often. A patient starts to lose a completely healthy tooth. It simply starts to loosen and shift little by little from this pressure and, so to speak, practically falls out. The third consequence, as I already mentioned, is tooth wear. That is, there is a tremendous load on the remaining teeth and the teeth really do start to wear down, and patients notice this immediately in the mirror. Most often, this starts with the lower front teeth. The patient practically grinds them away. In fact, a patient can actually lose up to a third of their teeth due to wear. The fourth thing that can happen if you don't restore your chewing teeth in time is a change in the temporomandibular joint. The first thing that can appear in the joint is what's called clicking. That is, the patient actually notices and says, "My joint is clicking," and one of the more serious consequences is pain in the joint when opening the mouth suddenly or while chewing, so the joint reacts or adapts in the same way to our bite, to the remaining teeth. It either moves forward or, on the contrary, shifts backward. And in this way, it adapts to conditions that, so to speak, were not created by nature. Accordingly, of course, the joint itself changes, specifically the joint capsule. And this is exactly what leads to both pain and those clicking sounds.
And what exactly is harmful about these things if something like this starts happening with the joint? It starts to click or moves in an unnatural way or something else happens. Can this lead to any other consequences?
I didn't say it lightly. These are very serious consequences because working with joints is practically, let's say, a separate science in itself, or specific approaches. It's not just about the fact that it will be difficult to restore normal joint function later, but also that changes can occur in the joint that simply can't be reversed. That is, the surface itself gets worn down. Inside the joint, everything is actually quite simple. It has a receiver, the lower jaw, and our joint moves like this, and then the joint itself starts to wear down, the head, the fluid that's there, the ligaments, and this can become so irreversible that even if we restore all the teeth and do everything correctly, our joint will remain in the condition it is in. In other words, it will simply be impossible to restore the joint, and the person will most likely be left with these clicks, maybe not with the same pain, but some discomfort in the joint will stay with them forever. That's why these are truly very serious changes, and it's important to pay attention to them in time so that these irreversible consequences involving the bone itself, the joint itself, don't occur.
So the worst that can happen is that some discomfort and clicking will remain, and that's it.
We're not just talking about some minor discomfort, it's about changes to the joint itself. That is, our jaw can either move forward or, on the contrary, collapse inward. But I believe the most significant consequences are, of course, as I've said before, changes to the bite itself, and then the joint simply won't function the way it used to. So let's put it this way. If the joint is in its normal state, it moves like this very tightly. But when it's, so to speak, damaged, can you imagine what happens? That's it. You can't make it smaller anymore. It's already worn away part of the bone inside the joint, and now there's this so-called looseness. Can you imagine that? It's impossible to restore it. There's nothing you can do about it anymore. So it will either move forward or, on the contrary, backward. That's why it's so important, I'll say it again, to restore your chewing teeth in time so that these irreversible consequences don't occur in the joint.
And if the bite changes, what consequences can that have?
The bite, of course, has a strong impact on the teeth we restore later. So let's say we lost some teeth, our bite changed, and then, as much as possible, the prosthodontist or surgeon tried to correct the bite to bring it back to the normal position it should be in. But since we already have changes and a disrupted bite, of course, even the new, well-made teeth will wear down in the same way because the bite is still unstable, let's say incorrect, and will end up wearing down and chipping the new teeth just like before. There will also be excessive load, so the joint is a very, very important element. I'd say one of the most important when it comes to restoring teeth or the bite. The next consequence of losing chewing teeth, or in fact losing any tooth, even just one, is that in the area of this defect, in the place where the tooth is missing, well, in this space, some patients say, I have a gap between my teeth. Right in this spot, in this space, if we don't restore this area in a timely manner, of course, the bone starts to recede. At first it becomes softer, thinner, and in this area the bone simply disappears. And if later on we want to place an implant there but the bone is missing, most often we have to resort to so-called bone grafting, where we first need to restore the bone and only then place the implant. That's why these are additional financial costs that the patient will have to pay in order to restore this area in the future. Or there are also cases, especially when there are large gaps of missing teeth or a large area of missing teeth, where the bone can recede so much that it becomes really difficult to help the patient. In other words, it will simply be impossible to place an implant there, and most importantly, it will be impossible to perform bone grafting. It also won't be possible to artificially build up the bone because the remaining bone will be too thin.
So if the situation is really terrible, is it truly impossible to restore the bone at all?
Exactly.
And what options are left in that case?
Most often it's either removable dentures or they make special large titanium structures that are screwed directly into the bone. These are actual plates, real plates so to speak, where they add bone using metal. But if we're talking about the lower jaw and if we're talking about the upper jaw, then it's simply longer implants, the so-called zygomatic implants, which are also screwed into the bone. Not exactly into the jaw, but let's say into the base of the skull. So these are long implants like this. That's also an option, but only in cases where there is absolutely no bone left.
And if, say, 1, 2, or 3 teeth are missing and bone grafting is needed, how much longer does the whole process take then? Does this somehow make the implantation process longer or not?
It depends. Let's say it's about 50-50. Sometimes we do bone grafting and place the implant right away, and in that case, our treatment plan remains the same, about 4 to 6 months. But sometimes we first do bone augmentation, wait from 3 to 6 months, and only then place the implant, after which we wait another 3 to 6 months. So the treatment period, or rather the rehabilitation period, simply doubles. Now I'll tell you how to restore missing molars. I'll start with the most expensive methods and move to the least expensive ones. The cheapest method isn't always the worst, so watch until the end to find out how to restore your teeth using an affordable, proven method. The first method is traditional implantation. Implantation is, of course, the most advanced and modern method, and I believe it's definitely one of the most rational choices. What does implantation help us achieve? It allows us to restore our teeth fairly quickly, most importantly without involving the neighboring teeth. In other words, we don't need to grind down the adjacent teeth or involve them in any way. So we simply place the implant and then directly onto it, after about 3 to 6 months, we put the crown. That's why the first method, implantation, is currently the most advanced and modern. What are the pros and cons of implantation? Well, if we're talking about the cons, probably the most common one is the price. So very often patients, of course, mention the price, saying, yes, it's expensive, you need to save up. That's probably one of the main drawbacks. And if we consider as a downside that implants don't take root, that's not really the case. Implants integrate very well nowadays, so I think the main drawback is the price. Maybe in rare cases, let's say there's an individual intolerance when a patient actually has an allergy, but that's extremely rare nowadays. So I would still say the main drawback is the price. And as for the advantages, as I mentioned, you don't need to grind down the neighboring teeth. It's a real artificial titanium root. This is your artificial titanium root, which will handle the load very well. And in just 3 to 6 months, we can give you a finished tooth. By the way, you could probably also stretch and call the waiting time a drawback, because from the moment the implant is placed to the moment you get your finished tooth, sometimes we have to wait up to 6 months. So for some people that could also be a downside. People just don't want to wait.
Actually, a lot of people worry about whether the implant will take or not. So what's the real situation right now? Do implants generally take well, or are there still cases where they get rejected?
Let me speak specifically about the experience in our clinic, and probably also about my closest colleagues from different cities, different clinics, and even different countries. These days the success rate is very high. It's high not only because the titanium itself has changed, let's say the quality of the titanium is different now. It's not just because the methodology has changed a bit and continues to improve, but also because in our clinic we start with a thorough diagnosis. We carefully examine the patient first. First of all, what has really elevated our work and eliminated many of our drawbacks is the 3D scan or computed tomography, where we can literally examine the bone layer by layer, millimeter by millimeter, to see what's happening. This success is closely linked to modern diagnostics. So the first thing is the 3D scan. That's why this already affects, as we say, the success rate of integration, because before we had to rely on what's called a panoramic image, a regular X-ray, where we could easily miss certain nuances. That's the first point. The second is, of course, blood diagnostics, where we initially assess the patient's overall health condition. That includes calcium, cholesterol, blood sugar, general iron levels, and, God forbid, any viral infections, right? Or immune diseases, which also used to affect the success rate of integration. So if the patient has done all these tests and we see that everything is fine, then there definitely won't be any problems, especially if the patient follows all the recommendations given by the doctor right after implantation and later after the crown is placed. In fact, such a tooth or implant will last a very long time and there won't be any rejection. The second method is the most traditional one. Of course, everyone already knows about it. It's been around for a very, very long time. These are bridges or crowns. Some people call them bridges, others call them crowns. We call them bridges because sometimes, visually speaking, when they're installed, it really looks like a bridge. 3 or 4 teeth can be fused together, right? They can be made of metal ceramic or nowadays zirconia. In the past, they were entirely metal, but these are solid constructions that, so to speak, consist of several teeth. Let's say, for example, we have one neighboring tooth and then another tooth, and in between, there's a gap between us. So we make a 3-unit crown, meaning we prepare the two adjacent teeth and place crowns on them. In the middle, we have what we call a pontic or a bridge, basically an artificial tooth that replaces the missing one. It's quite a good method and a traditional one. In terms of options, it can absolutely be chosen as well. But the nuance is that you have to grind down the neighboring supporting teeth. Wherever the bridge is attached, in any case, we'll need supports. You know, if you compare it, the name a bridge is quite literal, just like a bridge over a river, right? It needs two banks, the left and the right, and the bridge in the middle. It's exactly the same here. We need two banks, and these two teeth, will have to be ground down. So again, it's the same here. But once again, I'm saying, in principle, it's absolutely fine, you can choose this option. But the downside is that we have to grind down the neighboring tooth. In addition to grinding them down, we also treat them. In other words, we depulp them and remove the nerves. That tooth is now dead. So of course, the advisability of destroying healthy teeth like this is probably not ideal. But again, I'll repeat, our main goal is to restore chewing function. That's why choosing bridges is both possible and necessary. The downsides, as I mentioned, are that the neighboring teeth have to be ground down, and it's less durable because the teeth under the crown start to deteriorate. By the way, patients often write to us in the comments or come to the clinic and say, my bridge has lasted 30 years already and nothing has happened, it's been great. In reality, not everyone is so lucky, and very often the teeth under the crown start to deteriorate and the patient doesn't feel it or see it happening. And most often, when we remove such bridges after some time, we end up taking them off together with the teeth themselves. Can you imagine that? But yes, there are some people who really do get lucky. We remove the crowns and they still have strong teeth underneath, so we can put new crowns on them again. But once again, not everyone is that lucky. So when someone says, mine lasted a long time and nothing happened, well, that just means you were really, really lucky. For the most part, the downside is that the teeth under the crowns start to deteriorate, and after some time, 10-15 years, you'll lose those teeth as well, and they'll have to be removed. As for the advantages of crowns, well, it's definitely the speed. Basically, in just 3 to 5 days, you can have the teeth prepared, treated, and the crowns placed. It's fast. And unfortunately, we live in a time when price is an important factor. Of course, the price, it's cheaper than implants and faster than implants. So I think that's one of the advantages. And third, as I promised, the simplest and cheapest method is removable dentures. There are several different variations of them. Most often these are removable dentures. Some are clasp dentures. Clasp dentures can be metal or acetal, meaning they're made of plastic. We attach them to the existing teeth. Most often these are the central teeth, using clasps, these little hooks, and the denture is simply put on. So our chewing teeth are on the denture, which you put on and take off in order to eat and chew. Yes, there are certain nuances of discomfort when wearing them, but overall this is a good solution to the problem, as I said before, to preserve our neighboring teeth, to prevent the upper antagonist teeth from shifting down and to keep our adjacent teeth from moving. And that's why these removable constructions are actually a very good choice. It could be said that this is a kind of temporary solution to save up some money, possibly. But once again, our goal is to restore chewing function, so removable prosthetics should by no means be dismissed. Therefore, if you have this option, you can confidently choose removable constructions as an alternative. What are the disadvantages of such constructions? Well, of course, the fact is that unfortunately, even under these removable constructions, the bone still recedes. So that's one of the drawbacks. Bone atrophy occurs in any case, maybe not as quickly, but it still happens. And as for the advantages, it's definitely the speed. That is, within 3 to 5 days, a prosthesis will be made and fitted for you. And just like with crowns, the price is a factor. In other words, the price is as affordable as possible. I think anyone can afford a removable denture to restore their chewing function. You may have various questions, so you can write to me personally using the link in the description. It's better to restore your teeth, at least with this method, that is, with removable prosthetics, than not at all. So the most important thing is, don't be afraid, start moving toward your goal. If you have this specific problem, it is essential that you see a professional dentist. Be sure to visit a dental clinic, and together with your doctor, you will find the most effective and reasonable solution. And let me emphasize once again, you are free to use any method that works for you. The main goal is to restore chewing function and replace the missing teeth.